Hey, Dr. Temp here, and I know a lot of people have knee pain, and knee pain sufferers need to know that it's one of the first joints to go in the knee if your hip or lower back or your body is out of alignment, because a lot of times we are going up the stairs. Some of you might have been athletes or recreational weekend athletes, whether it's golf, tennis. Your knees are so important. I want to show you ways that you can protect it right away. Now, the first thing is, if you are to hurt your knee, maybe it's from hiking, maybe it's from sports, maybe you overdid something. The first thing that you do is you rest it and you elevate it. Don't ice it right away unless if there's swelling that is preventing blood flow from going further down into your feet or ankles. If your feet and ankles are getting the right amount of blood flow and the knee is slightly swollen, that's absolutely okay. So you don't need to necessarily ice the knee. That's number one. Number two, if the knee stays swollen for more than 6 weeks, you should seek help. Whether it's an x-ray, an MRI, or an ultrasound, you should find out exactly what's going on with the knee. And then from the diagnosis, there's multiple ways to treat it. A cortisone shot is usually not something that is recommended to go with right away because it's not necessary, and most of the time it's not, because the cortisone, what it does is that not only will it numb the nerve endings around the knee, it'll also tear down your blood supplies to the knee, tendons, ligaments, and the muscles around it. It actually weakens the structure of the knee when you have a cortisone or a steroid shot. So you might ask, well, Dr. Tam, what should I do with it? What you should do is, number one, speak to a specialist who can help you, like the providers in our clinic. We work with people who have knee problems all the time. We can start off with bracing, we can start off with laser therapy, rehab of the knee, making sure that your knee is working the right way, it's motioning the right way. After you do that for a while, well, if we take an image and we find that there is arthritis and there is trauma to the knee, then possibly regenerative medicine might be something that could be good for you as well in the long run. So it really depends on what we find with the knee. But before you do anything invasive like a steroid shot or any surgery, seek other help first. Now, this is the time, maybe within the first 2 to 3 days, when you say, well, when should I use ice? Is when it is restricting blood flow to other parts of the body. Or if it's really painful, put a little bit of ice on it and numb that area. But most of the time, you do want to allow the inflammation, at least the acute inflammation of the knee, to really start working itself out so that it doesn't continue to be chronically inflamed, because that's really where the healing comes in. The swelling comes in is because your body's bringing cells, T cells, white cells, macrophages to come in and actually clean out that area. It's the body's protective mechanism to not allow you from hurting it, from moving it as much. And that's why it's restricting motion at the same time. So the next time you have a knee problem, make sure you find help, rest it. You can even put a little bit of heat on it after the first few days. But really find out exactly what's going on. There's certain supplements that you can take with it as well. So make sure you do it right. Don't just jump into something very invasive. And within the last decade, there's been more and more studies on how regenerative therapy can help knees. If you're under 45, PRP might be an option. If you're over 45, that's where other types of regenerative medicine therapy can also help as well, because it's really hard to use your body's own regenerative factors and growth factors if your body's not really regenerating that much to begin with. All right, so until next time, speak to a specialist about your knee, protect your knees, strengthen. One of the key things I forgot to mention is you have to strengthen your hips, shoulders, and upper back, strengthen the glutes and hips to make sure that your knees are protected that way. All right, we'll see you next time.